The SPIRE trial is a phase 1, phase 2 study that we started through a collaboration with the Combinations Alliance with the UK Experimental Cancer Medicine Centre and also in collaboration with Astex Pharmaceuticals, who own Guadecitabine, which is one of the drugs that we're testing. And so the idea was to try to understand how we might improve on current conventional chemotherapy, both for bladder cancer and also potentially for other cancers that use that form of chemotherapy. So at the moment, if you have an advanced bladder cancer, or indeed if you need neoadjuvant chemotherapy for bladder cancer, then the standard treatment is to use platinum-based chemotherapy. And in this trial we combine Cisplatin with Gemcitabine, which is probably what most centres do in the UK and indeed globally. But we know that a proportion of patients who have curative treatment will relapse, probably as many as half of them. And patients that have incurable disease and receive this form of chemotherapy have relatively poor prognosis. The median survival is only in the order of 14 months. So there's a significant unmet need. And there is preclinical data from a variety of sources that suggest that one of the mechanisms for resistance to cisplatin is based on silencing of certain genes by promoter methylation. And we have a class of drugs that are used in hematological malignancies, DNA methyltransferase inhibitors, that are able to reverse that process and re-express silence genes. And in some hematological malignancies, that's already a standard treatment approach. So the preclinical data would suggest that you can reverse cisplatin resistance with the combination with a DNA methyltransferase inhibitor, and that's what we've done in this trial. We've taken a drug, Guadecitabine, which is a novel DNA methyltransferase inhibitor, and we combined it with Cisplatin and Gemcitabine in so far a phase 1 dose escalation study. And we were able to show that the combination is safe and tolerable. We found that we did see some myelosuppression, and we mitigated that by incorporating GCSF prophylaxis. But beyond that, it seemed to be a tolerable and manageable combination. And so we're going to present that data here at ESMO. We also have some pharmacodynamic data that shows that we get changes in methylation as a result of the addition of the drug, which you would predict, and we were able to measure that in blood. And we hope that going forward that might be a way of developing this as a non-invasive marker for the effects of treatment. And so what we're now doing is a randomized expansion in patients who are due to receive neoadjuvant chemotherapy for bladder cancer. And so that study is ongoing at the moment in the UK, run by the Clinical Trials Unit at the University of Southampton.